Welcome to myeyecademy.com. I'm Professor Mahfooz from Pakistan. In this video, VMCQ 7.5, we'll discuss the cornea MCQs number 5. Before going into the MCQ, let's study the indications of the keratoplasty. 4 types of indications. Optical. In optical keratoplasty, we replace the cornea to improve the vision, and there are much more chances of, or great chances of, improving the visual acuity. The conditions are keratoconus, scarring of the cornea, bullous keratopathy, and corneal dystrophies. In these 4 conditions, if we change the cornea, the vision will be much better. As compared to optical atrophy, in cosmetic keratoplasty, we change the cornea for the scar, like both of these look the same. But in this patient here, if we change the cornea, the vision will not improve, or the chances of visual improvement are not great, so we call it cosmetic. So cosmetic is done only for the cosmetic purposes, while the optical is done to improve the vision. Then the 2 other are therapeutic and tectonic. In therapeutic, we do it to treat a condition, like this patient has got a corneal abscess. We want to treat it, so it's a therapeutic keratoplasty. In the tectonic, means making the cornea or restoring the anatomy. Here the cornea is very thin with the desmetocele, and here the cornea is perforated. So restore the corneal integrity, we do the tectonic keratoplasty. So optical keratoplasty is to improve the vision, therapeutic is to treat a disease, tectonic is to improve the integrity, and cosmetic is only for the cosmetic purposes. Let's start the MCQs. Most common indication for the keratoplasty is bullous keratopathy, corneal degeneration, corneal dystrophies, corneal ulcers, or keratoconus. Bullous keratopathy is the second most common indication for the keratoplasty. Corneal degeneration is not that common. Corneal dystrophy is not common. Corneal ulcer is a therapeutic keratoplasty, but not as common as the keratoconus. So keratoconus is the most common indication for the keratoplasty, followed by the second, which is bullous keratopathy. So my answer will be number 5. Let's see. Keratoconus is the answer. Next MCQ. Tectonic keratoplasty means doing surgery for. So you're doing surgery to restore the integrity of the cornea. Bullous keratopathy, corneal scar, corneal thinning, keratoconus, non-healing corneal ulcer. Non-healing corneal ulcer is therapeutic. Keratoconus is optical. Bullous keratopathy is optical. Corneal scar is optical. So corneal thinning, when the cornea is very thin and you want to restore the integrity, that's called tectonic. So let's see the answer. Corneal thinning is the answer. Next MCQ. Tectonic keratoplasty means doing surgery for bullous keratopathy, corneal scar, desmetocele, keratoconus, and non-healing corneal ulcer. Same options, just number 3 is being changed. Instead of thin cornea, we have written desmetocele here, so desmetocele will be the answer. And desmetocele is the answer. Next MCQ. Therapeutic keratoplasty means doing surgery for. Look at the name, concentrate, therapeutic. So you want to treat rather than improve the vision. Bullous keratopathy is optical, corneal scar is optical, corneal thinning is tectonic, keratoconus is optical, so non-healing corneal ulcer is a therapeutic cause, so that would be the answer. Let's see. Non-healing corneal ulcer is the answer. Next MCQ. Cosmetic keratoplasty means doing surgery for bullous keratopathy, corneal thinning, keratoconus, opaque white cornea in a blind eye, non-healing corneal ulcer. So you already know that it's a cosmetic one, so we are doing it in a blind eye only to remove the opaque cornea so that the cosmetic look improves. So number 4 is the answer. Opaque white cornea in blind eye is the answer. Next MCQ. Next MCQ. Optical keratoplasty means doing surgery for corneal thinning, desmetocele, keratoconus, non-healing ulcer, or opaque white cornea in blind eye. Because it's an optical one, so keratoconus is a condition in which you do optical purposes keratoplasty to improve the vision, while the rest are other indications, so that would be the answer. Keratoconus is the answer. Optical keratoplasty means doing surgery for improving vision, restore anatomy, cosmetic purposes, to treat the ulcer, to remove the white opaque cornea in blind eye. The last one is cosmetic, treat the ulcer is therapeutic, not for the cosmetic purposes, is not for restoring anatomy. So optical keratoplasty is done to improve the vision, and the four conditions are keratoconus, corneal scarring, corneal dystrophies, and degenerations. Improve vision is the answer. Let's concentrate on this slide before answering more MCQs. It took me many days to animate this slide, so please do concentrate. Look at the first one here. Here in the top slide, we are replacing all the 5 layers from the donor to recipient. So all the 5 layers are replaced. So we call it penetrating keratoplasty because we have penetrated all the way into the anterior chamber. In the second one, the top 3 layers, epithelium, Bowman's membrane, and stroma, are replaced, and we call it deep anterior lamellar. So deep because it is deep, and anterior lamellars are taken from one cornea into the other cornea, so we called it DALK, deep anterior lamellar keratoplasty. And in this, the top 3 layers are replaced. Look at the next one here. Bottom 2 layers along with some part of the stroma are replaced, and we call it DSAEK, DSAEK, or Descemet stripping automated endothelial keratoplasty. And in the final one, only the bottom 2 layers are replaced, which is endothelium and Descemet membrane, and we call it DMEK, or Descemet membrane endothelial keratoplasty. So these are the 4 types of keratoplasty which are practiced at the moment. Penetrating keratoplasty, all the 5 layers; DALK, the top 3 layers; DSAEK, the bottom 2 with the part of the middle layer; and DMEK, only the bottom 2 layers. So with this knowledge, let's start the MCQs. Penetrating keratoplasty is replacing all the 5 corneal layers, epithelium, Bowman membrane, and stroma, that is DALK; endothelium, Descemet membrane, and posterior stroma, that is DSAEK; endothelium, Descemet membrane, and anterior stroma, there is no such surgery; endothelium and Descemet membrane, that is DMEK. So all the 5 layer is the answer, which is penetrating keratoplasty. All the 5 corneal layer is the answer. Next MCQ. DALK in corneal surgery is replacing, again the same 5 options. So the DALK is replacing epithelium, Bowman's membrane, and the stroma. That's why it's called DALK, or deep anterior lamellar keratoplasty. So the answer would be epithelium, Bowman's membrane, and stroma. Number 2 is the answer. Next MCQ. DSAEK in corneal surgery is replacing. Remember from the previous slide, DSAEK is replacing the bottom 2 layers along with the part of stroma. So all the 5 layers is not answer. Epithelium, this is DALK. This is the answer because we are replacing endothelium, Descemet membrane, and posterior stroma. Number 4 is not a type of any surgery. Endothelium and Descemet membrane is DMEK. So number 3 would be the answer. Let's see. Number 3, endothelium, Descemet membrane, and posterior stroma is called DSAEK. Next MCQ. DMEK is a type of corneal surgery which involves replacing Look at the options again, pause the video, look at the options and then answer. My answer would be endothelium and descent membrane. Let's see the answer. Endothelium and descent membrane is called DMEK, and that's the answer. Thank you very much for being with me, and please do visit youtube.com/@Professor Dr. Mahfooz 7544 for more videos, and please do give your feedback. Thank you.